So atrial fibrillation is the commonest abnormal heart rhythm. It's commoner in those who are older. It makes the heart beat irregularly and fast. So normal heart conduction starts from the top of the heart, sends signal to the top collecting chambers, the atria, down to the middle, which sends a signal down to the big pumping chambers, the ventricle. Now these collecting chambers can sometimes fibrillate or quiver, and that sends lots of signals, and that's what atrial fibrillation is. And all those signals come down to the heart, make the heart beat irregularly and too fast. So this is very important in the management of atrial fibrillation, because if the heart's beating too fast, it can affect the heart function. And the management is based around controlling that heart rate, but also maybe controlling the rhythm, and in some people getting them back to normal rhythm or having more periods of more normal rhythm. Atrial fibrillation can come and go, we call that paroxysmal, or it can come and it's there all the time, called persistent. So atrial fibrillation can be caused by many things and is associated with many different conditions. For example, anything to do with the heart, but importantly, hypertension. It increases with the incidence of atrial fibrillation increases with age. Any heart disease. Also, those who are younger and get atrial fibrillation, often it's linked to being overweight or obese, or drinking large amounts of alcohol, but any type of heart condition or lifestyle can cause atrial fibrillation. Atrial fibrillation is the commonest abnormal heart rhythm. It's often can cause symptoms, but often can just be an incidental finding as well. If the heart function is good and the heart rate can be controlled, because one of the issues with atrial fibrillation is that the heart rate goes too fast. So if the heart rate can be controlled and the heart function is good, then the prognosis is good. There is an important point about this, is that those with atrial fibrillation are at slightly higher risk of having a stroke. So their yearly stroke risk is higher. And this will be assessed by your doctor and a decision made whether you need blood thinning medication to reduce your risk of stroke. So those who are diagnosed with atrial fibrillation should seek medical attention, and that stage, a decision about stroke risk reduction using blood thinners will be made. If you think you have atrial fibrillation, you should go and see a doctor. So it's important, if you have any symptoms that are unusual, that you see your doctor and get an ECG or a heart rhythm check to make sure you haven't got an abnormal heart rhythm such as atrial fibrillation. So symptoms may be palpitations or the sensation of your heart beating fast or irregularly, but sometimes symptoms can be less specific, such as tiredness or breathlessness, or just feeling lethargic, unduly lethargic. So all of these symptoms can contribute, atrial fibrillation can contribute to any of these symptoms. So if you're not feeling right, or something doesn't feel right from a heart point of view, or breathless or tiredness, you should see your doctor to ensure there's not an issue with your heart rhythm. The management of atrial fibrillation initially involves controlling the heart rate. So in atrial fibrillation, the heart beats regularly, and it makes the heart beat too fast. So it's important to control how fast the heart is beating. And once the heart rate is controlled, that will help improve your symptoms and allow the heart to work efficiently. So that's the first stage. The question then comes whether we try and get your heart rhythm back to normal rhythm and have more periods of normal rhythm rather than irregular atrial fibrillation. And that can be done in different ways, with medication or stronger anti-rhythm medication, or even procedures called catheter ablation, which involves burning away where the triggers for the irregular heartbeat come from, the atrial fibrillation. That's the first step of management. The other step, which we've discussed, is the importance of assessing stroke risk and using blood thinning medications to reduce the risk of stroke. And these are highly effective in reducing risk of stroke. Both of these things will be assessed by your doctor and a management plan made for both of these. So atrial fibrillation affects people in different ways. There are those people where we can control the heart rate and the heart function is good and then the prognosis is good. You'll need blood thinners to reduce your risk of stroke, but from a heart point of view, the prognosis is good. However, there are some people where atrial fibrillation can affect the heart function, and it's very important to try and reduce the amount of atrial fibrillation, or what we call reduce the burden of atrial fibrillation. And there are many ways of doing that, including, as we discussed, with medication or even procedures such as catheter ablation. So importantly, the good news is, although atrial fibrillation is very common, because of that, we're very used to managing it. We can look at different ways to managing your atrial fibrillation to ensure we get the optimum health benefit to you.